Welcome to the Medicine Made Easy podcast, where we answer your medical questions. Now, here's your hosts, Sven Hosford and Dr. Chet Fox. Welcome, everybody. This is the Medicine Made Easy podcast. This is our first episode in our new studio. Thanks very much to the people at Studio Me Productions for their kind assistance and such a great and positive experience that we're having here. And we're going to talk today about kidney disease. And what the most important things are: how do I know if I have kidney disease, and what could I do about it? So my name is Sven Hosford. I'm here joined with my co-host, Dr. Chet Fox. Dr. Fox, it's good to see you.
Delighted to be here. I'm very passionate about this subject.
You're a big expert on this, so we're really looking forward to finding out what you want to say about it. And we're also here in the studio with Albert Calfo, and he is the CEO of Health Defender, and they are the producers of a product which I'm very fond of. It's called Kidney Defender. So we'll be talking about that. First, I want to invite you to call us or text us 646-543-7836, or you can go to our website, medicinemade-easy.care, and submit your questions. That's what we do here on Medicine Made Easy. We ask you what it is you're most interested in. But today we're going to talk about kidney disease, as I said, and specifically we're going to, kidney disease is also known as chronic kidney disease, or CKD. So if I say CKD, that's what that means. We'll find out what are the symptoms, how do I know if I have it, what are my chances of having it? And just a little heads up, if you're over 65, the chances are 1/3 that you have it. How likely am I to die? What am I likely to die from if I have it? And sadly, the vast majority of that is going to be heart attacks, disease, or strokes. And the most important question we're going to answer for you today is, how do I reverse it? So we're going to start off with Dr. Chet Fox. Dr. Fox, give us a little bit about your background, how you became such a kidney expert.
Well, it started actually with, I was a professor of family medicine at the University of Buffalo. And I used to joke that I was the chairman's vice president. You know what vice presidents do? They go to funerals in Bulgaria, anything that the president doesn't want to do. So he said, I want you to go to this lunch with the National Kidney Foundation and a local nephrologist. And it was a very nice place, so I didn't mind having the lunch. And the nephrologist comes and he looks at me and he says, what are we going to do about distributing the new chronic kidney disease guidelines to family physicians? And I go, what? You mean there are new chronic kidney disease guidelines? And he says, oh yeah, there are. My attitude about chronic kidney disease at the time, and maybe a lot of doctors out there share the same attitude. Well, I treat high blood pressure, I treat diabetes, and when they need dialysis, I send them to a kidney specialist. So that started me on a journey. I started looking at my own charts and said, am I diagnosing chronic kidney disease? And it turns out that I had a lot of patients with chronic kidney disease I didn't know about. And I discovered that to myself. And then that started me on a lecture tour. And my lecture tour was promoting the National Kidney Foundation's, they call them KDOQI guidelines, Chronic Kidney Disease Outcomes Quality Initiative, KDOQI initiative. So I started speaking for the National Kidney Foundation on that. And I realized that I was doing a lousy job diagnosing chronic kidney disease. I was doing a lousy job treating chronic kidney disease. So my first lecture was called Confessions of a Primary Care Physician: My Transformation in Understanding the Importance of Early Recognition of Chronic Kidney Disease. Basically, when you're looking at chronic kidney disease, there are a couple of things that really stand out. It's basically uncontrolled high blood pressure and uncontrolled diabetes are the two main causes of most of chronic kidney disease. So that's how I got started in this. And I realized there were a number of things, simple things that you could do to help patients prevent progression of chronic kidney disease.
Is it beyond just treating blood pressure and diabetes?
Well, although that's important, that's just the first steps. It turns out that there are medicines that are over the counter that are very damaging to the kidneys. We call these medicines non-steroidal anti-inflammatory drugs. They have lots of names: Motrin, Aleve, ibuprofen, the Mobic. So there's a number of drugs. The non-steroidals are very bad for both the kidneys and the heart, so they should be avoided. But there are also drugs that are very good in preventing the progression of chronic kidney disease. Some of those drugs are called ACE inhibitors, angiotensin converting enzyme inhibitors. So we call them ACE inhibitors, or angiotensin receptor blockers. Now, you can know what drug you're taking, the class of whatever drug you're taking, by the last anywhere from um, 4 to 8 letters in the name. So angiotensin converting enzyme inhibitors, or ACE inhibitors, always end PRIL or PRIL. So it's lisinopril, there's monopril, there's others, but if they end in PRIL, that's an ACE inhibitor. And an angiotensin receptor blocker always ends in sartan, SARTAN, olmesartan, losartan, etc. So knowing the end, those are helpful, and avoiding that and controlling the high blood pressure and diabetes is what we would tell patients for any number of years. Say, if you do those things, we can help prevent the progression of CKD, because current dogma is you can only prevent progression. You cannot reverse it.
Oh yeah, we're going to get into the dogma here in a minute. Um, so, what are the dangers then? How specifically does this cause problems when our kidneys start to go?
When our kidneys start to go, it's it's really an inflammatory condition. So when the kidneys start to go, it increases the risk of heart attacks. Um, it causes inflammation in the blood vessels, and inflammation causes a lot of bad things in the body. And the biggest thing that occurs is heart attacks. In fact, for people with stage 4, we'll talk about the stages of kidney disease later. People with stage 4 CKD, before they progress to stage 5 or dialysis, 80% will die of a heart attack before they ever end up on dialysis. The other big problem with chronic kidney disease that people know about is dialysis. Um, and if the kidneys start to deteriorate rapidly, people end up on dialysis. And I can't tell you how many patients are told, "Oh, your GFR is really low. The only thing we can do for you is dialysis." And that's not true.
It's not true. We are living that right now. So, are there any symptoms related to if I did not go get a GFR test, how would I know if I have any kidney problems?
You wouldn't,
Ah, well, that's
not unless, yeah. Kidney disease is like hypertension. It's a silent killer. It progresses totally silently in people. And the great majority of people with chronic kidney disease have no clue that they have it.
wow. So the test we want to take is the GFR test. Is that right? Or anything
Well,
else?
there are two tests. One is a blood test called the eGFR. That stands for estimated glomerular filtration rate. um, and the urine albumin creatinine ratio that tests spillage. Let me explain a little bit about the disease in general. The kidney is the water filtration system in the body. Just as we have water filtration plants, so the kidney is the body's water filtration system. And the EGFR measures how good the water cleansing system is in the body. So the kidney takes toxins out of the body, throws it into the urine, we pee them out so it doesn't do bad things to the body. So that's the estimated glomerular. And why it's called estimated, it's very expensive to measure the glomerular filtration rate directly. But everybody breaks down their muscle at a pretty consistent rate during the course of the day. So by measuring the amount of muscle breakdown in the urine, in the blood, you can know about what the kidney function is. So that's the first test. The other is the urine albumin creatinine ratio. Think of this as like a spaghetti strainer with holes. As the holes get bigger, more protein leaks through those holes. So it measures the protein that leaks in the urine. And by measuring a spot urine, comparing the amount of creatinine in that urine to the amount of protein in the urine, or albumin. Albumin is a form of protein. It's a specific form of protein. So by measuring those two things, we can measure how dangerous the kidney function is to any individual. The danger from either a low EGFR, because the worse it gets, the lower the number gets, or the higher the amount of protein in the urine, the higher the amount of albumin in the urine, both of those are very dangerous. In fact, the National Kidney Foundation has this nice thing that's called a heat map, which we will put up later, which shows the levels of each. But I do have a paper published that shows that the protein in the urine is as dangerous as the low filtration rate.
Wow.
So both of them are bad.
We'll make sure we get a link to that in the podcast notes here. Well, besides, we talked about diabetes and high blood pressure, and I've talked about people over 65. Who else is most likely to have kidney disease? What are some other warning signs?
Well, there are other forms that are kidney disease. There's something called IgA nephropathy. That's like IgA is a type of antibody, and it attacks the kidney on people. It was a very good football player for the Buffalo Bills who had to end his career because he had that. The other is polycystic kidney disease, which tends to be genetic, where cysts form in the kidneys. Those are less common, but they're also forms. But the main thing we really want to be talking about is what occurs because of either high blood pressure. And it should be noted that in African Americans, they tend to have much higher blood pressure than whites. There's probably a genetic reason for that, but it's not uncommon to have very poor control of blood pressure. So that in African Americans, even without diabetes, they can get chronic kidney disease just from the high blood pressure alone.
Sure.
And most whites who don't have as severe hypertension, they usually have both. It's usually the diabetes alone can cause the chronic kidney disease if it's poorly controlled, and the diabetes combined with hypertension makes it very difficult.
Yeah. What's
So it's really going to encouraging people to go to their doctors and at least annually getting a blood test for diabetes and a blood test for the urine albumin creatinine and a blood test for the EGFR in addition to the high blood pressure. If they do those things and the doctor, takes care of them, they should do well.
Are there any lifestyle or nutritional issues that might lead to more chronic kidney disease?
Obesity and insulin resistance. So, um, and nutritionally, it's important to have a diet that really fits your genetics. And they finally changed the food pyramid to say that, okay, protein is good for you. Um, One of the things that people with chronic kidney disease, they say, oh, don't take protein because it's bad for the kidneys. That has proved really not to be the case. A high protein diet is okay. In severe chronic kidney disease, they may have to monitor it a little bit. But in early chronic kidney disease, protein is not a problem. So things that they can do, exercise is very important, and I don't like the term exercise. I like the term activity. So the best thing to do is find an activity that a person likes. That can be walking, that can be gardening, that can be whatever. Um,
Getting up
you
and
know,
moving
that
around. Yeah.
yeah, pickleball or whatever they enjoy. Yeah, getting up and out of the chair and moving around. Even simple things like uh people now stand and work instead of sitting and work.
Oh, right. Standing
You know,
desks. Yeah. Hmm.
standing desks are things that are helpful. The point here is they need to do things that they can do and they're willing to do and that they enjoy doing because that's what happens long term. There was a study that showed that the two activities that people do for a lifetime are walking and gardening.
Mm. So we've talked a little bit about this, but I think this is a point worth reinforcing is that there really are no pharmaceutical options to treat CKD. Is that basically true?
No, well, no, that's not
Ah,
correct.
well, there I go.
Um, well, that's why I'm here.
That's what you're the expert.
That's
I'm
what,
just the journalist. Yeah,
yeah, yeah, that's why they pay me the big bucks.
that's right.
Yeah, the 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 like we said before, the ACE inhibitors and angiotensin receptor blockers help the kidneys, but we found that some of the diabetes drugs now also help the kidneys. The GLP-1s, those weight loss drugs, and it's not just from the weight loss. The GLP-1s help the kidney, and the other uh, GLP-1s are things like Ozempic, Mounjaro, um, the things you've seen that have been used for obesity also are good for kidneys and help controlling blood sugars, not just from the weight loss, and they help the kidneys. And the other is some of the newer diabetic drug is called SGLT2. I didn't even know what the name is. I'd have to look it up myself, but it's Invokana, Farxiga, and Jardiance are the three brand names of those. Those also help the kidneys,
Hmm.
and they also help people with congestive heart failure. So they in addition to treating diabetes, they found uses with helpfulness for kidney disease and others. There is one newer drug on the market for chronic kidney disease. I don't even know um, the name of it, that has been shown to help chronic kidney disease. Um, it's an expensive drug. A lot of help can be done with cheaper drugs.
Yeah.
But so I haven't been that fond of it, but there is a newer one. So there are pharmaceuticals that the doctor will know about that will help, but all of them say this will help slow the progression.
Slow the progression, but it doesn't
Slow the
actually
progression
reverse it.
doesn't actually reverse it.
There you go. All right. This is another important issue I think we need to talk about, and that is hydration and dehydration. It's so important that we drink enough water to help flush our kidneys. Can you give me the medical expert advice on that?
Um, Basically, the more the better, but don't overdo just pure water. Because that will dilute other things like electrolytes in the blood. So
So
things
add
like
electrolytes then.
things like Gatorade Zero or any of those, you know, electrolytes. The avoidance of salt, or the restriction of salt is also a good idea. Um, and fruits and vegetables are very helpful for the kidneys.
Right. Right.
Fruits, vegetables, dairy, um, products, are very helpful for the kidneys. Now, they have found that for the kidneys and other things, both the Mediterranean diet and plant-based diets are generally healthy diets for folks, but there are those of us who cannot stand it. Uh, it's okay to have protein, and meats, even fats. You know, uh, you can still have a high fat, high protein diet as long as you don't combine it with a lot of carbohydrates and don't gain a lot of weight. The weight and the insulin resistance is the important issue,
Yeah.
not exactly what you're eating in terms of fats. So obviously, straight sugars are bad, you know,
Right.
and should be limited. Um, you know, the but I recommend to all patients with diabetes to get a glucose meter, whether it's a Freestyle Libre or Dexcom. And that's been shown because then you can know what foods raise your particular blood sugars. So, for example, I am terrible with rice and pasta, but I can eat potatoes without raising my blood sugars as much.
Hmm.
So they're still, those three are still pure carbohydrates. Now, another person may be able to take pasta and potatoes raise their blood sugar. But so it's good to have the meter in front. Oh, I take this, my sugar goes way up.
Yeah.
So
Everybody's different. There's no one size fits all.
we're all
Things.
we're all in that's the we're all individuals, and family history is very important. You can ask a person, they can tell you what runs in the family. And there's a person, his name was Dr. Lynch. He now has a syndrome named after himself. Um, all he did was take the family histories of people that had cancer and people that didn't. And he found that there were cancer prone and cancer resistant families. If I ask a patient, what's in your family, they can tell me. All my people have had heart attacks. All my people have had cancer. You know, all my people have had, strokes. The- you can't underestimate the genetics along those lines.
Hmm.
And there's newer stuff going on with the whole gut microbiome, which hopefully at some point we'll have someone talk about. The effect of the bacteria in our gut have a lot to do with our health, even our mental health.
Oh, that's for sure. That's for sure. Well, let's get right down to it now. This is the real, if I can use the term, meat of our discussion here. Um, let's talk about nutraceuticals options. And this is where we're seeing a lot of promise, and a lot of people are actually reversing kidney disease. So, Dr. Fox, we've got a product that we promote, and I'm real big on, and that's called the Kidney Defender, and it's got three main uh, substances in it. Can you say what those are and what are the main benefits of each one of those?
Yep, it's interesting that you should mention that because um, we had a person buy the product and said, "Oh, do you have a one pager we can give to our patients that would describe these?" So I'm working on a simple one pager to deal with that. And there are three ingredients, and I will go through what they are. Then I will go through their individual benefits. Then I will go through what some of our preliminary data has been in terms of using that. The first thing and the most important thing is niacin. Uh, also called nicotinic acid. It's also vitamin B3. So it's just a B vitamin, and it has some really important effects in the body. It is anti-inflammatory, and kidney disease is an inflammatory disease. It is an antioxidant. You know, when you think of oxidation, think of rust. So, you know, basically what rust is iron oxide. It's oxygenation of that. So an antioxidant would be removing rust from the body effectively. It causes, and I was shocked to learn this, gene repair. So if our genes are damaged, it can actually repair them, which is, I think, part of the reason between the anti-inflammatory effect and the gene reversal, why we're starting to see some reversal with um, with our product. From the complications, and we didn't talk about the complications if you get chronic kidney disease, which we do need to talk about. One of them is high phosphorus. Now, why is that a problem? In the bloodstream, you have calcium and phosphorus combined being at a certain number. So the more phosphorus in the blood, the less calcium in the blood. The more calcium in the blood, the less phosphorus in the blood. So when the phosphorus increases, if the calcium can't be in the blood, it goes into the arteries. And we call that atherosclerosis, which is a fancy term for hardening of the arteries. But it's hardening because they're calcified and they become rigid. And that's what creates all the problems with like heart attacks and strokes. So it lowers it lowers phosphorus.
Okay, wait a minute now.
That's the first product.
Uh, I need to stop on this point because I think a lot of people have the thinking backwards about this. I think people think that hardening of the arteries has a lot more to do with eating meat or too much fat, and you're telling me it's because of kidney disease and too much phosphorus in our bloodstream.
Yep.
Wow.
Well, but that's not the only cause, but it's one of the causes. You know, if it's more the insulin resistance than the fats we eat that causes it. So when we get insulin resistant, it it the inflammation pushes calcium into the arteries. In fact, what we do to decide if a person's at risk for heart disease is we measure the calcium in the coronary heart arteries. So the arteries that supply the heart, when they calcify, that's when people are at risk.
Wow. So we've talked about niacin.
But we're not done with that. Yeah,
Not done with
niacin, right.
niacin. All right.
No. We're done with that's enough for niacin.
Okay.
Then there's calcium carbonate. Calcium carbonate lowers phosphorus also.
Yeah.
And then the third is sodium bicarbonate. Sodium bicarbonate prevents and treats metabolic acidosis. Metabolic acidosis does a ton of bad things in the body. It prevents the heart from pumping well. It causes, just think acid. You know, you don't want acid in your arteries, but it prevents the heart from pumping well, in addition to a number of other um, negative effects in the body. Sodium bicarbonate prevents and treats it. How we got into this was the three of them combined, by reducing the phosphorus, preventing the metabolic acidosis, and all the positive effects of niacin. We heard that there could be a possibly reversal. The first person that this was done on was an 82-year-old man. The 82-year-old man had bypass surgery, stents put in, really bad coronary disease, and his EGFR, EGFR goes from basically 5 or less to about 100. It can go over 100, but so think of it as a percentage. So this person's EGFR was 19. So they were getting him ready uh, for dialysis. And he had really bad coronary disease. So he was put on these three things, and his EGFR went from 19 to 61 over a 3-year period of time. So that was a major improvement. But not only did it improve that, he lived for 12 years after that and died at age 94 of pneumonia, never having another coronary event that whole time.
Wow.
Just so you know how this works, his life expectancy at that time, where he had an EGFR of 19 and severe coronary artery disease, was 1 to 2 years expected lifespan, outside high expectancy 5 years.
5 years, right.
He went 12 years and had no further coronary events. And so basically, we will talk about, when we talk about the complications of kidney disease, if you have kidney disease, you have heart disease.
Mhm.
They go together. So when you protect the kidneys, you protect the heart. So I used to have a kidney compass with things that says basically, save your kidneys, save your heart. So that's how it got started. Since that time, using the product, we now have 13 people that we have data on. We're trying to collect pre and post data. And the average increase in glomerular filtration rate is 51%.
Wow.
And you're an example of that.
Yes, I am.
You're not at 50.
I went
So-
from over it was over 60 for most of my life. And then a year and a half ago, I come in, I get checked every 6 months, and it was 53. It went from 66 to 53, and my doctor kind of freaked out, and he sent me to a cardiologist, which I didn't understand then, but I understand now, and started taking the Kidney Defender. And the next time I went in, a couple months later, it was back over 60. It was back to 61. So I have personally reversed kidney disease, and I think that's really the bottom line that we want to conclude this part of the discussion with is, can kidney disease be reversed with, especially with a nutraceutical approach? And not only, I mean, we say that, but let's talk about what some of the science that's out there that
Well,
proves that.
let me talk a little bit about dogma and irreversibility.
Yeah,
So
my favorite
when,
topic.
when I was when I was first in medical school, you know, we had a guy said, "Oh, I can reverse coronary disease. I can reverse heart disease," and everyone said, "No, no, you can't do it." He actually became very interested in lowering people's cholesterol and other things, and said, "I can reverse." We all thought he was crazy. Um, then 10 years later, with uh, advice, we said, "Oh, what do you know? We can reverse coronary artery disease." So now that's believed. Then we said, "Oh, the brain, you drink alcohol, you lose 10,000 brain cells. You're never going to get those back. You know, the brain can't be reversed."
Can't be reversed.
And, you know, that if you have brain disease, the brain can't regrow. Well, then they found out brain neutrophilic factor. And all of a sudden, they said, what do you know? The brain can regrow. So every time in medicine they've told us with dogma that it couldn't be reversed, we found out it could be reversed. And I think we're going to find the same with chronic kidney disease. And in fact, not just our approach with the nutraceutical, there was a person who was treating long COVID, and he just cleaned out the respiratory system. And he found just serendipitously that kidney disease reversed with him. So we now have two approaches
Huh.
that may reverse kidney disease. And we're trying to get funding to do a research study comparing those two approaches for reversing kidney disease.
Well, for
So,
anybody that wants to follow up on the science, I really love that on the Health Defender website, you have 75 different studies that show the effects of niacin on and these other two substances, calcium carbonate, sodium bicarbonate, on kidney disease. So there's lots of scientific evidence that's out there. That's what I find the most exciting.
Kidney Defender. Now there's a solution to chronic kidney disease. Did you know that 1/3 of Americans over the age of 65 have chronic kidney disease? 1/3. So I should not have been surprised when, after I turned 65, I discovered I had it. Then I discovered Kidney Defender. It's safe, it's affordable, and it really, really works. But don't just take my word for it. Here's what some other health professionals have to say about Kidney Defender.
We were very aggressive in using niacin in our cardiovascular protocols. And lo and behold, what we started to notice was that our chronic kidney disease patients got better too. And that was a huge revelation to us because we didn't think that chronic kidney disease could be improved once it started on the trajectory. We now know that that is not true at all. It's a colleague of mine who developed this amazing product called Kidney Defender, and it has all those things in one place. And it's got niacin in it. All products that we use to reverse kidney disease in one bottle.
I've had the opportunity to use Kidney Defender, a supplement developed by a brilliant lipidologist and scientist who is also a dear friend. I have been very impressed by the formulation and really the science behind it. In my own clinical experience, several patients on Kidney Defender have shown measurable improvement in renal function, and it's a very promising option for those seeking to support their kidney health. It's clear that Kidney Defender is the result of years of dedicated research and expertise, and I'm grateful to have access to such a thoughtfully developed product. I'm optimistic about its continued role in improving kidney health for all my patients.
If your EGFR is lower than 60, you owe it to your kidneys to try Kidney Defender. Now you can save 30% when you go to the Health Defender website. Use the code SVEN26 when you check out, and you'll save 30% on Kidney Defender.
I want to bring Albert into the conversation here. Albert Calfo is actually an old friend of mine, and I've always been impressed by how he was an entrepreneur, and he had a bunch of different kind of medical companies, and they all really did good work and, performed a good service for a good price. And he seemed to be making a ton of money about it with it. And so I was very happy to find out after I discovered that I had kidney disease that Albert's now the CEO of Health Defender, and their first product is Kidney Defender. So Albert, it's really good to see you here.
I'm glad to be here. Thank
Yeah.
you. Sylvan.
So tell us a little bit more about yourself. How did you become a serial medical entrepreneur?
Well, I was a stockbroker in the 1980s, and I had a physician client that asked me to put together a medical partnership for a mobile CAT scanner. Not only was it very good investment, but I was fascinated by it. So I left the financial industry to focus on putting together medical ventures. And over the last 40 years, I have started, built, and sold several medical companies.
And what drew you to this particular venture? What was it about the kidney disease and the nutraceutical solutions
Well,
that drew you?
my last company was a medical billing company, and I had a very large endocrinology client. And the physician in the practice told me that he had a lipidemiologist that had a combination of supplements that could actually slow or reverse kidney disease. Didn't believe it, of course, and he showed me the data. I was actually so impressed with it that I decided to sell the medical billing company and dedicate myself to this cause. I watched what this lipidemiologist was doing, and he was asking the people to go on Amazon and buy 3 or 4 bottles of different supplements. Then they had to keep track of which supplements per day from each bottle they had to take. I thought that was rather cumbersome. I wouldn't do it myself.
Mhm.
So I came up with the idea, why don't we take all these ingredients, put into one capsule? And that's how we formed Health Defender. We're creating a capsule with all the ingredients in it in one capsule.
That's Kidney Defender.
Kidney Defender.
Yeah. What are some of the core company values?
Well, I think anything we develop has to be easy to use, has to be cost effective, and has to show positive outcomes. Let's take Kidney Defender for instance. Kidney Defender is two tablets for lunch, two tablets for dinner, all from the same bottle. That one bottle is exactly 1 month's supply, easy to keep track of. It's $2 a day, cost effective, and we're seeing tremendous positive outcomes from this.
Yeah, absolutely. I'm one of them, as we said.
So anything we develop will have those three criteria. They have to be easy to use, cost effective, and show positive outcomes.
And I also admire that you tend to surround yourself with really good people of integrity. What do you look for when you go to hire somebody?
Well, they have to believe in our mission. They don't have to know anything about nutraceuticals. We can train them. We can teach them. What they have to have is the same enthusiasm we have, same passion we have, and share our core values.
Now, talk about some of the new products that are going to be coming out. Well, so you have Kidney Defender. Tell us about other products that you do have now and other products that are coming out soon.
Well, we have Fitness Defender, and Fitness Defender is a vasodilator. It increases blood flow. It's for the serious workout community. We have Focus Defender. Focus Defender is getting tremendous reviews. People are feeling sharper.
Gets rid of the brain fog.
Yeah, get through the brain fog for sure. We're looking at a blood pressure or a heart defender. A certain population has a gene mutation that the synthetic medications don't seem to be working for, but our combination therapy is working. So we're pretty excited about that. That may be out soon. And then we're working with a hormone doctor to develop some hormone supplements
Okay.
that we anticipate that'll be out within 4 to 6 weeks.
But most of your products are related to or have niacin as one of the key products.
Yeah,
Key
the
ingredients.
first ones I described have niacin in them.
Yeah.
The hormone therapy will be completely different.
It's funny, and I think we should
what-
go ahead.
Can I
Dr. Fox.
jump in here? Because on the Focus Defender, I am totally addicted to it. It turns out, I was taking, Fitness Defender, which is very similar to the Focus Defender, and the Fitness Defender did a great job in terms of improving my limited workouts, so I was able to do better. But I happened to notice that I was a lot more mentally clear. So that's what produced Focus Defender. So I now take it. And what I found was that when I started to take it before work, I go, gee, I don't need coffee. I'm a lot more alert and I'm working later into the evening without, usually by 3 or 4 in the afternoon, I was done. First 2 hours of the day, I call them my golden hours. Perfect. And, my brain is clear. 3 o'clock in the afternoon, I was done. So I found that I went till 7, 8 o'clock and I was still mentally alert. And that was just with one pill in the morning. And they said, I don't need coffee anymore. And actually, I don't drink coffee anymore, where I needed coffee every morning just to be able to do it. So I am much more alert with the Focus Defender. We've given it to a number of people, and they found the same thing. Without telling them that the Focus Defender will also help their workouts, I gave it to a neighbor who's a construction worker. He said, yes, I'm a lot more mentally clear, but also I know I'm not as sore after work.
Wow.
Yeah, we're very excited about all our products.
Well, I've been just so impressed by the topic of niacin as something that, here's this amazing substance, and you could probably talk about this more, Dr. Fox. It has no side effects other than the flush, and we've talked about the flush because you guys come up with a great thing to treat that. But also, there's no maximum limit. I mean, you can take as much of this as you want, and even just 100, 200, 500 milligrams a day does such a wonderful job at all these different things we talked about. Can you talk a little bit more about that, Dr. Fox?
Well, let me talk a little bit about the flush. People ask about side effects. And so the flush is a side effect, but it's a positive side effect. It shows that the medicine is working, but it's also a nuisance side effect. We've had people take the Fitness Defender and others, and they said, and people take the Kidney Defender and they flush and say, I am not touching that. That's why we came up with our infographic, but it's not like a side effect of another drug, where it's negative. It's not negative. It's actually just a sign that the medicine is working.
Well, let's talk about the flush. What is the what do you do when you get the flush and it's uncomfortable?
Well, the best thing to do is to try and prevent the flush, you know, and we have the infographic, but the long and the short of it is it's good to eat when you take it, just food. Applesauce, if you're not eating, just taking a little bit of applesauce, or if you're on aspirin, if you take aspirin, even the baby aspirin, half an hour before, all those will prevent the flush. And in the Kidney Defender, we put a product in there called isoquercetin to help reduce the flush on people. And honestly, we haven't had as many people stop the Kidney Defender, you know, because the the flush occurs. It's a flush in the face, but it can also be a tingling or an itchy sensation. But if people realize that's a positive thing, not a negative thing,
Yeah,
that's
sometimes like
helpful.
the Fitness Defender, some of the serious workout people like the
They
flush.
love the
They
flush.
feel
Yeah,
the flush.
yeah,
The same ones that do the cold plunges.
yeah. That's do the cold plunge. I've personally done the applesauce. That works
Mm,
fine.
okay.
Three spoonfuls of applesauce and the flush just goes away.
Yep.
But as you said, it's not really. I mean, it's not painful. It's a little uncomfortable. I feel like I may be having one right now, but um,
Well, I do want to talk one thing about niacin, and it's just a vitamin B3. There are studies, and the biggest one was a VA study that studied people from the VA for 15 years, and there was an 11% reduction in mortality from coronary artery disease. Now, what happened was the drug companies couldn't make any money on it. So they created a Niaspan, the extended release, gave it high dose, and that caused liver problems and other things. So niacin got a bad name, but it was because of what the pharmaceuticals company did so they could make money on it, not because niacin does bad things to the body.
we could probably do a whole show on nefarious conduct by
Yeah.
the pharmaceutical industry, but let's not go there right now. Um, but it kind of explains why it's ignored by most doctors. I mean, the whole nutraceutical
And not just
industry
not
is
just
ignored.
well, well, guess, here's a pop quiz for the two of you. Guess how many hours of nutrition training I had in medical school?
I
Zero.
would say 0.
Zero.
Ding, ding, ding. Exactly. So, you know, the doctors are trained just on randomized controlled trials. You're not going to do a randomized controlled trial on basic nutrition because it's almost impossible to do.
Right, right.
So,
Well,
in
we've got
terms
about,
of getting,
I'm sorry, go
yeah,
ahead, finish up.
no, so there's not a lot of quote evidence base behind nutrition, but we need to do evidence a different way. Instead of a randomized controlled trial, we need to look at common people and their habits. And this is this person's habits versus that.
Yeah.
And then look at the results
Well,
in nutrition.
we've got about 10 minutes left here. Let's have a little discussion about just the future of nutraceutical medicine, how that fits into integrative medicine, functional medicine. How do you see it from the business perspective, Albert?
Well, it's a growing industry. People don't want to take synthetic medications. Synthetic medications have side effects. I see the whole industry growing substantially in the next 5 years.
Well, that's fantastic. Dr. Fox, anything you want to add to that?
Yeah, no, at the same point of view is that, and we talked about this in our introductory podcast, is that Western medicine has specifically, and it's done great things, in terms of curing complex diseases, but it hasn't looked at preventing or keeping people healthy. So nutrition, food as medicine is a critical part of it.
Huge.
And you talk to any of the longevity people, they're all talking about nutrition, or they're trying to synthesize it. Balance of nature, for example, just fruits and vegetables in a pill,
Yeah.
or Immuno 150, all the ones that are on TV, just 150 nutrients in a pill. I honestly, that those things can help, but there are people who've gone on, some of the plant-based diets, the Mediterranean diets, and other things, and have markedly improved their health.
Yeah, absolutely. Absolutely. Anything else you want to add to our discussion here? This has been a great, interesting
It
discussion.
has been.
I think, one of the things that we need to, that the American society or people in general need to understand is that nobody cares about your health as much as you do. Your doctor doesn't care that much. And as you said, Dr. Fox, he's not or she not going to be that interested in curing you. They're going to be interested in treating your condition. And in this case, I'm so happy to say we've got a product here with Kidney Defender that does more than just treat the condition, but it actually reverses kidney disease. I'm really, really happy
That's
that
great.
we're here and doing this. So Health Defender will be a regular sponsor on
Okay,
our
great.
podcast.
Appreciate it.
And Dr. Chet Fox and I will be back on a regular basis with more questions. And of course, if you have any questions,
I want to
submit. Go
I
ahead.
want to tease our next guest.
Yes, let's do that. Since we're talking about functional medicine, integrative medicine. I met Dr. Stephen Dahmer a few years ago, and I was really impressed with his smarts and his personality. And so I was really over the top pleased to find out that he took over as the director for the Andrew Weil Integrative Medicine Center in Tucson, the University of Arizona. So he has agreed to come on our podcast. We're still working on nailing down a date, but we're very excited because he's a great guy, and we have a lot of really good information about integrative medicine and some different programs that are available. And of course, if you have any questions that you would like to submit to us, go to our website, medicinemadeeasy.care, C-A-R-E, or you can call our phone number, 646-543-7836. Albert, Dr. Fox, it's great being with you here today. You've been listening to the Medicine Made Easy podcast, produced by Medicine Made Easy Productions. Please send us your questions via the link at medicinemadeeasy.care or call or text 646-543-7836. Your questions will determine what topics we'll cover and which experts we'll get to answer your questions.